Welcome to Joymed Podcast, brought to you by SafeHaven, a program of the Medical Society of Virginia. I'm Melina Davis, your host. I'm the CEO and EVP of the Medical Society of Virginia. We're thrilled to announce the launch of this new podcast series, where we'll delve deeper into the challenges faced by healthcare professionals, explore strategies for resilience, and highlight the support systems available to them. Each episode will feature expert insights, personal narratives, and practical tools to help foster a healthier, more supportive environment for our healthcare heroes. Make sure to subscribe to our podcast so you don't miss this important series, and share it with your friends and colleagues. Together, we can create a culture of care and support, ensuring that those who care for us are cared for as well. Thank you for listening, and we look forward to continuing this journey with you. This is Melina Davis, and I'd like to welcome you to Joymed, our new podcast. And we'll be talking today about SafeHaven, a program that's so near and dear to our hearts. And I'm so excited and happy to welcome two really upcoming stars of medicine. One, I'd like to welcome Megan Entrepont, who's a PA student from Randolph-Macon. Welcome, Megan. And Rusty Hawes, who's a medical student at UVA. Welcome, Rusty.
Thank you.
Thanks for being here with us today to talk about this very, very important topic. It should just be a fun morning with us together, and I know people are going to learn a lot. Let's just jump right into the conversation. Tell me, Megan, why you decided to come into medicine and be a PA.
So in high school, I really loved all of my science classes, specifically my biology class. And so I knew I wanted to do something in the sciences. And then in my undergraduate at college, I realized I really liked talking to people and helping people and hearing their stories. And so I thought I could combine my love of biology and my love of people and hearing about kind of what's going on with them in a career in medicine.
Science and humans.
Yeah.
I love it. Rusty, what brought you to want to be a doctor?
Fairly similar to Megan. I really like talking to people and I like interacting with people on a day-to-day basis. I've always enjoyed science. I got into research in high school and college. And then during my gap years, I got involved with HIV prevention. And so that really drove me more towards medicine and wanting to work directly with patients.
I love these stories. It's wonderful. What surprised you the most about your journey to become a clinician?
You know, medical school is a lot harder than I thought it would be. And I think every medical student has a similar story. We do well through high school and college, and you think you're on top of the world, and then you get to medical school, and it is hard for everybody. And so that's been difficult, but also just like finding community with fellow medical students and how many friends that I've made in medical school has been really great, and I cherish the friendships that I have. It's
so interesting because people, I think, sometimes have the perspective that medical school can be so competitive. So it's really interesting that you note right away that community is so important and you found it.
Yeah, and I really think that can vary from med school to med school. Some places do have different cultures, but I'm lucky at the University of Virginia that it is a very friendly environment and supportive environment.
I love that so much. Megan, what about you? What surprised you the most on your journey so far?
I think my biggest surprise was the career that I landed in, physician assistant. I didn't realize that was really an option. I was the first person in my family to want to work in healthcare. And so kind of like everybody, their base knowledge was I thought I could be a nurse or a doctor. I didn't realize that there were so many different paths and so many different careers in healthcare.
Yes.
And so it wasn't until probably the end of my junior year in college that I realized that there could be a master's program where I could go to school for 2 years and then kind of be right into the workforce helping people. So that was my biggest surprise, was that I could be a PA, which is really cool.
Oh, I love that. I love that. What's your favorite part so far of being a PA?
I love the option to switch between specialties. I'm somebody that is just so curious about everything and wants to do everything. It's really cool to me that I could work in pediatrics for a couple years and then decide to switch into a surgical subspecialty or go into ortho or dermatology. I think it's really lovely that my whole career I could kind of explore all the different things that I want to explore in medicine.
I love that. I love, too, that you said the word curious, because I do think it makes life fun when you maintain that curiosity.
Totally,
yeah. I love that. How do you feel about mental health and well-being these days while you're in school? And do you think that the issues around well-being are being discussed more with you than students who've come before you?
I think I'm in a unique position in terms of students before me just because I'm the first cohort at Randolph-Macon College for PA students. So I don't have kind of older classmates or an older student population to pull from there. But I believe that RMC's PA program is so carefully curated around like well-being and mental health and putting that at the forefront.
I love that.
So it was definitely spoken about in our first day at orientation. We were given different telehealth resources where we could have online counseling for free through our tuition. And they talk about managing stress levels. We are assigned a faculty advisor to check in with us periodically in kind of like a one-on-one setting to see kind of what's going on. And the college campus also participates in the Green Bandana Project,
yes,
which I think is really cool. It's about suicide prevention and awareness. It started in Wisconsin, and the PA students there are kind of active on campus with that as well.
Oh, I love to hear that. It's at the forefront of conversation even as you start. I think that is significantly different than what other people have experienced years before, even if at Randolph-Macon it's brand new. Interesting. What about you, Rusty? What do you think? UVA is, of course, a long historied medical school. What do you think about how it's being handled with you all and compared to the past?
Yeah, I definitely think that we talk more about well-being and mental health now, and I think every year there's more discussion and work on it, which is really good. Medical school and medical training, residency, everything that comes after are very stressful. It's long hours, it's difficult work, both like intellectually, just studying all the time, but then working with patients and seeing patients through the hardest parts of their lives. And that wears on medical students and residents and physicians. So I'm glad that we talk about it from the very beginning. Similar to Megan, we start early. We talk about well-being and we work on ways to maintain well-being throughout our training. And we definitely do it more than they used to. Just talking to our professors and like how different things are now than they were in even like the 90s or the 2000s. But I think there's definitely still improvements to be made and work to be done. But I'm glad that I'm at a school that takes that seriously.
Me too. I've heard some stories from the past where I think folks were expected to just sort of, the term was suck it up, deal with it, move on.
Definitely.
Right. And are those the kinds of stories you're hearing from your professors?
Oh, yeah. And I mean, some of that does still exist, unfortunately. But I think that the first step to improving that is talking about it and working towards it, even if it's not perfect yet.
Yeah. Just a question for both of you. How do you think your fellow students are perceiving the current climate with well-being and mental health in the professions that you're moving into? What do you think they perceive it to be?
I think the perception is generally that things are better than they used to be, but that there's, like I said, there's improvement to be made. There's definitely some tension. That's the word I'm looking for. There's definitely tension between like, how do we get all the training that we need? How do we maintain a regular schedule and hold everyone to the same standards, while at the same time working with every individual to make sure that their mental and emotional health needs are met. And that's difficult, and I understand why there's a tension there. But in terms of like how fellow students perceive it, I think a lot of my fellow students now are definitely looking for greater strides towards mental health and more institutional support. So we've taken the first steps, but now a lot of people are looking for more.
Yeah, I'm going to come back to that. I want to hear what Megan thinks about this question about how people in your program perceive the climate and how people are dealing with it.
I think that it's definitely something that is spoken about more openly now, like mental health and well-being, and kind of combining what most students, I think, seek perfection over growth and resiliency. I think that's unfortunately the downfall of most people that are pursuing careers in healthcare is there's this drive and this strive for perfection, and that is, I feel like there is a place for that, and it's definitely something to aspire to, especially with being like interacting with people and like having to see them through the hardest times of their lives and knowing that there are higher stakes kind of involved with our profession. But it definitely, like, comparison is the thief of joy. And there's this quote I heard while I was volunteering with Capital Area Health Network the other day at a healthcare careers fair. There was a medical student at VCU that stood up to kind of address high school students. And she said that she just really wanted all high school students going into healthcare to remember that someone else's success is not your failure. And I thought that that was so impactful and so good to know, especially just as a high school student. I think it's really hard, especially with social media and kind of the access we all have to one another's lives, to perceive other people as being able to handle the stress better than you, or being able to absorb the information that's being thrown at you in a faster way. And so while we are talking about mental health more, I think there is the social media component, and there is the side of presenting your best self to people, and that kind of isolates you from wanting to share that you're struggling or that you're not doing the best that you can. So I think there's a schism there where we're talking about it, but it's almost like you can talk about it in a very abstract way that is not admitting that you are struggling with it or that you need help. So I think that's kind of the climate there, like Rusty was saying, that you are able to talk about it more, but there's still kind of a stigma about relating it specifically to yourself in the conversation.
And you think the stigma is social? Is it professional? Is it environmental? Or all of the above?
I mean, it's got to be all of the above. I think that socially, it's hard to admit in any workplace that you are struggling, right? I think that also just that search for perfection and that wanting to be your best self to present to your peers and your patients and your coworkers and your superiors, I think that that is kind of where the schism comes from, because nobody wants to say that they're struggling. But I'm excited about kind of the talks that are in place and the different fail-safes that are being put into the programs to try to catch people and have them have a safe place to admit that they need help.
Rusty, what do you think?
Yeah, I think part of that stigma is that every individual student struggles with different things. So some people may be really good in their preclinical years, but when they get to clerkships and clinical rotations, it's really difficult learning how to interact with patients and how to compile everything. For other people, they may be great in the clinic, but really struggle with studying and taking tests. And so at any given point, a student can look around them and see all of their peers appear to be doing well and feel like they're the odd man out, when in reality, everybody struggles in their own ways at different times. And it's difficult for every individual person to come forward and say, I'm having a hard time at any given point.
You know, I've found in my life that there's some things have been harder for me to learn, taken longer, taken more energy. But then there have been times in my life where I just wasn't at my best. I was struggling with personal things, or I'd had a hard professional experience. And then you need time, right? You just need time. And I'm not sure in healthcare training, we give you time to recover once you get punched, or you literally and figuratively sometimes in healthcare, right? Which is terrible to say, but I don't think people understand. It could be an emotional absorption of somebody else's experience, or it could be that patients have an emotional moment and they take it out on you, right?
Yeah.
Very difficult, and you don't have the time. So how do you deal with that? How are you thinking about dealing with those things? And are the schools giving you those kinds of training moments or conversational moments?
That's a really good point. One of the difficulties with like institutional well-being is often that it is like institutions hear that they need to support trainees or employees in terms of well-being or mental health, and so they will then impose well-being, and they'll say, okay, well, you need to do this for your well-being, and I think what you're getting at is actually really important, and that's that everybody has their own way of dealing with whatever issues they're having, and the best way to give everybody that opportunity is to just give them time and space and allow them to do what they need to in that time and space. Medical school is a hard time. There's a lot to get done and on a limited amount of time. But in some ways, it is better than residency. Once you get to residency, you're
yes.
locked into 60 to 80 hour weeks every week for 3 to 5 or 7 years.
3, 5, 7, 9.
Yeah, exactly.
Yes.
And med school, I mean, as students, we have a little more protections than even residents do. But even in medical school, it's difficult. So there's a lot of improvement that can be made for both med students and residents. But I think what's really important is that we can't decide from the top down how to be well and how to fix everybody's problems. But including time and space and allowing people to take that time and space when and how they need it is really helpful.
I think there's a perception among clinicians, and maybe this is partially true and maybe it's perceptive, that there's a record. There's they're writing everything down, that somebody will know when you have a moment you needed more time or you were not at 100%. I once knew a doctor whose CV was 100 pages long. Think about that.
I believe that.
And I don't know any other profession, really, maybe than people who are winning Nobel Prizes, right, who think that that is a normal thing, that you would write every single element down as you went. And that's their record keeping. That's not even the institutional record keeping that I think sometimes people that are clinicians and in training to be a clinician have in their head. What kind of pressure does that add? Does it make you feel like you can't take that moment, Megan, that you don't have time, or do you feel more independence than that?
So I think there's definitely a component of that just in healthcare in general, is feeling like you can't take a moment because everything is going all at once kind of everywhere. No matter what clinical setting you're in, it feels like there's always something you could be doing, whether that's,
that's true,
with a patient or with charting or with trying to learn something new. So there's definitely that aspect of it. I think something that really helped me is on our first day of our program, they sat us down with the old adage of it's like drinking from a fire hose, right? Like the amount of information that you are going to have to get through this year is astronomical. And the expectation that we are setting for you in terms of what the pass rate is or what would be considered passing your exams or your OSCEs or your what have you is tough. I think our program says you have to get an 80 or higher to pass, right? Which is a little bit higher than what I was doing in undergrad for some of my harder classes. The bar was raised for sure. And they said, we know it's a high bar. We're trying to prepare you to pass all of these kind of certification exams and what you need to get through. But the expectation from our program is that you will get below an 80 on some things. Like you are drinking from a fire hose. There are so many different components. You are learning how to study. And I thought that was so lovely to tell us on the first day, like we are anticipating that all of you in this room will probably dip below an 80 in something because there are so many different components going on. And there's just such a beautiful remediation process where you meet one-on-one with the professor of whatever you dipped below an 80 on. And you make like an individual plan for what is going on. Did you need study help? Do you need more time? What's going on there? And then you have the opportunity to relearn and retake and boost back up. I think there's this huge focus not on perfection, but on growth and resiliency that you can carry with you kind of throughout your career.
So much healthier.
And in speaking about time and not knowing what everybody needs, our program instituted Wellness Wednesdays. So they made sure that we ended class by noon on Wednesdays, and then we had the afternoon free. And we all knew that in the middle of the week, we would have half a day to do what we needed to do. And some peers went to the gym because that was their designated gym time. They knew they weren't going to have anything on Wednesday afternoon. Some peers went to office hours. Some peers went on a walk. Some peers went to Chick-fil-A. But we just all knew that we would have that half a day on Wednesday and nobody could touch it. And I thought that was really important, and it felt really safe to know that whatever was going on in the week, there was that middle spot where you could catch up and breathe, which was really helpful.
Idea to put it in the middle.
Yes.
That says a lot, right? Rusty, you had said earlier that there's more that institutions could, you think, be doing and do what's next. What do you think those things are?
Well, just to even bring this back to some of the pressures that we feel when we take time off, one of the pressures that we feel is this social environmental pressure that when I take time off, someone else has to pick up my slack. And that's the kind of thing that can come down to staffing in hospitals and institutions. If you have a certain number of people where if one of them takes the day off or one of them isn't able to come in for an unexpected reason, everything falls apart and everybody's scrambling. That has an effect on everybody that is there that day. Everything's harder for them. But that also has an effect on the person who took that time off because now they feel guilty for taking that time.
Yes.
If we build some redundancy into the system and have more robust staffing for physicians and for residents, then people don't feel bad taking that time off. And I think that's really important. That gets difficult because that requires money. And that's where things get tough from an institutional perspective. But a way to support medical students is, I guess, the first part is to just take medical students seriously. And it's interesting because, we're all college graduates. But when you enter the medical system, you are now the lowest rung on the ladder. And so we are looked down on. And to some degree, understandably, everyone else does have more experience than we do. But taking medical students seriously and listening to medical student concerns about our training plan and what we expect from a training plan, what we want from a training program, and how we want to be able to manage our own wellness, I think is really important. So taking input and actually incorporating input would go a very long way for everyone's wellness, because feeling like you are enfranchised in your own program and you can make a change in your own program is part of wellness in and of itself. And then to be able to incorporate wellness because you are enfranchised to change your own program is better for everybody.
It's so interesting. I regularly speak about this idea that humans are not widgets. They're just not widgets. Yeah. They're not mechanical parts that you just have enough on hand to use and turn, and the machine lets the heat come up, right? And that it'll just deal with it. Yeah. I think that institutions forget that humans are running the healthcare system, and that connection with patients is human, right? Yeah. And that people need time, and that's human. And that they need a voice, and that's human. But that's decidedly different from what I hear from people who've been in this for generations and been around to watch that medicine. Why is it different? Why do you need an input in medical school now or in medicine now in a way that our generation didn't need? We didn't get a voice. Why is it so important for you? Yeah. Do you, Megan, have any ideas for why it's more important to this generation and why it's important for well-being now?
I've definitely heard kind of the argument that you're alluding to in terms of, well, we did it. And I think that is such like a harmful mindset of, I went through this very hard thing and now you all will also go through this very hard thing.
Let's torture you too.
Right. Yeah. And I understand wanting to not be the only one that had to experience that. I think that would be really hard, to be the generation that had to let go of being the last person that had to go through what they're going through. But in terms of why it's important that we change it now, like, we have the data that it doesn't work, and it's not going well, like with rates of burnout, with rates of like physicians committing suicide, with rates of patient error in charting and in clinical work, and it's just not feasible and, in my opinion, not sustainable anymore. And so if we're going to try to keep this machine going, we need to make some edits there, you know?
And healthcare's changed so much. Healthcare doesn't operate the way that it did. So I'm not saying at all that it was acceptable then, but there was more autonomy. And I think now, as a widget, there's sometimes not any autonomy, right? Any time, any space to be human. Rusty, what do you think?
Yeah, no, I completely agree. That I suffered, so you should suffer too is a terrible way to go through the world. And I think most people involved in medical education, I don't think many of them want it to be that way. There's some tension between, like, how do we maintain rigor while also making this a better experience for everyone? And that's important. But I agree that we are much more conscious of mental health, and being conscious of mental health makes you very conscious of things that don't support mental health. And so for whatever that reason is, for whatever reason that we are more conscious of it, we we now want more from institutions, and that's something that we're focused on, and hopefully we can make progress on.
One of the things that I notice from our leadership and our board, and, we have leadership that range from 45 to 80 on our board, right? And so many different experiences through PA school and through medical school. They're the biggest advocates for well-being and mental health. And in fact, I would say Virginia has really embraced this as something they want to help change across the country, not just in Virginia, because they recognize we train so many medical students, we export so many medical students, but that it can't just be different in Virginia. It has to be different in the professions, right? So they're so passionate about it, and they believe so much of what you all are saying. The other thing I would say is they love spending time with PA students and medical students, that they remember what it was like at that point, and it reinvigorates them. And the magic, when I watch the young people and the experienced people get together, it's really fun to be around, and they crave it, right, that time, and they want to give. So I know that there is this generous emotional flow and commitment to the profession to make it better. I think that I see it. A lot of that's being manifested through SafeHaven. What do you guys think about SafeHaven, and do you think it's valuable? How can it help?
I think it's really great that MSV has championed this effort. I think it speaks to the power of organized medicine and medical advocacy, that we're able to come together as a profession to create this program to support people within our profession and beyond just our own profession. But I think this is a really good institutional support, since we've been talking about institutional supports. But this is a really good program to allow physicians to seek support when they need it and how they need it. Just to always have that in the background ready to go is really heartening, because a lot of people will need it at some point, but you don't know when you're going to need it. So knowing that it's there when you need it is really, really helpful.
I think so too. What do you think, Megan?
I love that it kind of encompasses all of healthcare, because like I said before, when I started, I thought you could be a nurse or you could be a doctor. I didn't realize that you could be all of these things, and I love that it's available to medical students and PA students and nursing students and pharmacy students and all of the in-between. I think that is another huge step in kind of welcoming everybody in that healthcare space and recognizing that everybody that works in healthcare might need some help in terms of well-being and mental health and that sort of thing. I think that's a big part of it and an awesome thing that they're championing.
Just gave me chills with that one, because I think that's really important too, because you're all in it together every day in the space, right? But also in this way that you can be healthy together.
Yes. And so I love that it's a resource that I can share with peers and coworkers and just people that I'm meeting kind of in my different clinical spaces. For me personally, I graduate in December. So I'm coming into my transitional phase between being a student and being a working healthcare provider. And it's a big comfort to me that SafeHaven exists and is kind of like a safety net and has all of these resources for leadership and for finance and for mental well-being and all of the in-between. I love that it's all kind of compounded in one space, and it makes the thought of transitioning between student to working clinician a little bit easier for me.
I love that. I've not heard that explanation before. That's very moving and important. Thank you for that. If you were going to say anything that you think people should know about SafeHaven or about your experience or the way that they can help, what would you say? What's your recommendation?
I guess I would just say that everyone in healthcare, in med school or PA school, at any stage of their training, everyone is going to struggle at some point with something. Understanding that not only will you struggle, but all of your peers and all of your mentors and everyone that you know is going to struggle at some point. And having that in mind on a day-to-day basis when you're interacting with your peers really helps you reframe how you interact with everybody else, knowing that they could be struggling right now and knowing, or at least hoping, that they would treat you the same way when you are struggling really helps to improve the culture overall. And if we as individuals improve that culture, then as we move up through the institution, then we can collectively change the institutions. SafeHaven is a great tool to help us do that.
Megan, what do you think?
I would just like to remind everyone that I think self-care feels selfish sometimes, for lack of a better word, but to know that seeking mental health care or taking time for your own well-being not only helps yourself, but also helps you maintain professional competency and helps you give your best self to your patients. That if you're someone that's really career-driven and it's really hard for you to take a moment for yourself, that knowing that taking that moment could really make a big difference in your patient interactions and your level of care that you're able to provide. I think it's a holistic process, and it shouldn't feel selfish to seek self-care.
So powerful. There's so many messages that say, don't eat, don't drink anything during the day, don't sit down, don't have a social moment, that people in other professions like me, we get. And just that moment, right, sometimes can refresh the spirit to let you give that focus and energy to somebody else. Very powerful. There's this idea about additional staffing. I want to follow up on the question of what can institutions do that make the environment a healthier, more resilient, more flexible space so that people have a chance to take a moment. We say, and I think it's commonplace, that the business of healthcare won't allow for additional expense for flexing, right? But what we know is to replace a doctor is $500,000 to $2 million and takes 12 to 24 months. That per doctor is expensive. We know that medical errors really start to show up when people get burned out, and that we know that patient outcomes aren't as strong when there's a loss of relationship between the healthcare provider and the patient, which naturally happens when somebody's burned out. So we're already experiencing these costs, but somehow they're not adding up in the dollars that we consider when we're at staffing or we're at creating healthier environments. How do we convince administrators to take a different, healthier business path to making healthcare healthy for providers?
I would actually go higher than administrators. Administrators and people that run hospitals have a difficult job. It's difficult to keep track of everything and to keep everybody satisfied. To go a level higher, hospitals and these institutions receive money from state and federal government, and how that money is allocated and how much is allocated often dictates staffing, especially with residencies. So advocating at those higher levels for greater funding for residency will improve our supply of physicians in the future, and will also improve resident and physician and medical student well-being in the present, because we will allow for greater robustness and staffing at institutions and allow people to take the time that they need when they need it.
I think this is probably true of nursing and PA resources.
I would
too,
agree,
right?
yeah.
And what else would you add? Do you have any thoughts on how we convince them to staff up or to see this as relevant and important to the health of their workforce?
we just continue talking about it. I think that especially the younger generation is more comfortable now advocating for mental health and well-being, and I think that the more we talk about it and the more statistics we can bring to their attention about the changes that have been made and that have shown great change in like mental well-being and retention rates and lower levels of burnout, I think just presenting those facts and continuing to bring it to the attention of the powers that be would be super important.
Super important. One other question. Have you had moments with patients that have had an effect on you emotionally in a way that you were surprised and that took you back a moment? And would you be willing to share that?
Mine is not with a patient, but a member of my medical school class died by suicide. So that was very difficult for our class and for our school as a whole.
Mm-hmm.
It takes you aback, and it really made everybody reconsider, like, what do we mean when we talk about wellness? We say that, like, we're focused on wellness and we prioritize this, but clearly it wasn't prioritized enough for everyone. And so it really put things into perspective for me in terms of what are we really doing and what outcomes are we getting from it? And how can we improve that so that the effort and the time that we put into this is actually worth something?
Mm-hmm. I love that. Thank you. And I'm so sorry. I know your community. It was devastating to everybody at UVA. Megan, what about you? Do you have a moment that you're willing to share about something that just surprised you and how it affected you emotionally and how you had to take a step back personally?
Yeah, so my surgical rotation, I was actually with the burn and reconstruction unit at VCU. And so we saw some pretty extensively burned patients, and they have much longer hospital stays and multiple surgeries involved in their care. And yeah, there's a lot going on there. And I was just so touched by the resiliency of spirit in those patients and the level of connection that they had with their healthcare providers, like their nurses, their PAs, their surgeons, their internal medicine providers. Everybody there on the ward knew one another and knew of each other's children and asked after family members and had personal pictures of past patients posted in the Clinicians lounge, because there's just such a deep connection that's formed there. And I was just so impressed by how people could laugh and joke and ask after other people's family members when they themselves were going through such a traumatic and difficult time. It really stuck with me, and I was just I guess I was floored by the level of compassion and empathy from both patient and provider in that space. It was really incredible.
That's powerful. That's powerful. And this is why you do what you do, right? I just want to thank you both so much for spending this time with me today and sharing your story and your thoughts and your wisdom already in your paths with all of us, so that we can help make healthcare a better place to work and a better place to get care. We're grateful for everything you do and that your commitment to help others. So thanks for being here.
Thank you.
Thank you.
Thank you for listening to Joymed, a podcast series I think you'll find very interesting and compelling, all dedicated to making our healthcare workforce healthier. Come back and hear us soon.